I know that we talk a lot on 3+U and in your everyday life probably about people having a New Year's resolution to lose weight and get in shape. But I also know that if you're someone watching and you do have a significant amount of weight to lose, talking about it very casually can probably almost come across a little bit insulting, because the hill to climb is not quite so easy when you're facing a lot of weight that you're trying to shed. So we're very happy this morning to have Dr. Jaime Ponce join us. He is with CHI Memorial Metabolic and Bariatric Care. Good to see you.
Good to see you, Julie.
I hope I've said that in a fair way, but it's a far different thing to have 10 or 15 pounds that you're wanting to lose than 75 or 80, and the approach is very different for people.
Yes, correct. So there's people that already have a significant amount of overweight, and even though they have tried many times different diets, exercise, lifestyle changes, the weight doesn't come off, and it's very difficult for them to sustain a good, significant weight loss over time. So fortunately, bariatric surgery is very effective. It's very safe. It has become the safest thing and the most effective therapy for patients that need to lose, 75, 100 pounds or more over the ideal weight.
So I know you enough to know you're not wanting to try to raise a concern unfairly. But the timing for us to be talking is very appropriate, because as the data comes in about COVID-19 and who is at risk, the obesity factor cannot be overlooked. And so for your patients, there's an added worry right now.
Correct. So obesity carries a lot of risks, as we know. The patients with significant overweight can develop type 2 diabetes, hypertension, sleep apnea. Now, when it comes to the pandemic with COVID-19, I think there's a significant risk of being overweight. There's several reasons why that happens. So patients with overweight, they have more difficulties with their lung function because of the pressure from the abdominal fat. And so when patients get infected with the virus, their respiratory compromise is more significant. Number two, they also have a lot of medical problems, as I say, type 2 diabetes, cardiac problems, kidney problems, liver problems, and all those can contribute for those patients to not do as well if they get infected. Number three, I think it's very relevant to say that the COVID infection carries a risk to develop blood clots. But obesity as well carries a risk of developing blood clots. If you combine those two, patients with obesity tend to have more of those blood clots problems that eventually may not make it through the infection. And I think number four is a little bit more intriguing. Fat cells, the virus needs a door entry to the cells to replicate. And that door entry are called receptors. And it just happens that the receptors that the virus needs are located in many cells, but on the fat cells, it seems to be overexpressed. It seems that there are more of those receptors. And so patients that have more fat cells, they have more of those receptors that allows the virus to get in and replicate. And so the persistence of the infection is more widely on patients that have obesity. And so if you put all that together, patients with obesity tend not to do as well if they get the infection. There's a nice study, Julie, that came out in Cleveland Clinic recently, that they look at all their patients that got infected with COVID, and they divided them between the patients that had overweight and the patients that had bariatric surgery. So this is very interesting. And the patients that had bariatric surgery, formerly they were obese, they did much better. They had 4 to 5 times less hospitalization, and none of them died. None of them got admitted to the ICU or put it on the ventilator, as opposed to the patients that were just overweight and not had previous bariatric surgery. So there is a protective effect to losing weight and sustain that weight loss to be able to fight the virus.
So let's talk a little bit about what you're doing in the practice, because one of the things that you've enjoyed over the years is the chance to educate your patients and future patients on what to expect with COVID. You're doing that now virtually, but it's not just that they're meeting with you on a scheduled basis. They can watch these videos and seminars at their own leisure, right?
Correct. This is very nice, because now patients can call in, they register, we give them a link, they can watch the seminar online. And then with that, they get all the information that they need so they can decide if they want to take the next step. Remember, it's a comprehensive program. We have to talk with the dietitian, psychology, exercise support, as well as the physicians, so we can take care of them.
Okay, you're big on support groups. You like folks to have a rally of support around them. So you've got the support group in place pre-surgery. Do you ever see patients who've had the surgery and then for whatever reason they don't maintain what they need to maintain and they need some help getting back on track?
Yes, so support groups are a big component of how these patients get supported over time. But some of the patients sometimes, we're humans and they tend to fall off track. They start doing things that are not optimal on their lifestyle. And so we have added support groups for patients that have not followed with us for a while and they need some help. They need to re-engage on their lifestyle, on their support. And so this is for patients that have had surgery in the past and they need additional help to re-engage into the changes that they need to make.
So in terms of getting in touch with your office, I mean, obviously everyone's a little bit concerned right now, especially with the COVID situation, but this is not a quick fix, is it, Dr. Ponce? I mean, what's the expected length of time start to finish?
Yeah, it's not a quick fix. So anybody that starts the process, they should expect to spend a good 2 to 3 months of being evaluated. We're going to sit down with the dietitian and we're going to explain to them all the different changes that they need to make on nutrition, on selecting the best food and eating the right way. And then we're going to talk about the psychology aspects and exercise aspects. Sometimes insurance may require for patients to spend a little bit more time. Some insurance require for them to go up to 6 months and sometimes even a year of a supervised program before surgery. Well, we'll take care of that as well. But I think in general, a patient should expect to spend, few months before the surgery to get the surgery ready.
Well, let me go ahead and give them the phone number and the contact information. That way they can at least begin by watching the videos that you have to share. The office, CHI Memorial Metabolic and Bariatric Care on Shallowford Road. Their phone number, 899-1000. You can also find them online, ChattanoogaBariatrics.com. Dr. Ponce, thank you.
Thank you very much, Julie.
Ashley Home Store's one-day sale. This Saturday only, buy one, get one half off. Or get 0% interest for 4 years plus 3 months.